I'm presenting today about the nursing demonstration projects that I was fortunate enough to participate in 2012-2013, and I'm presenting on behalf of Dr. Lucio Nacarella, who's working at the Melbourne University. So I just would like to say that, and I'm a co-author alongside Lynn Walker, who at the time of the projects was the National Principal Advisor for Nursing in General Practice at AML Alliance, and I was the Senior Project Officer. And it was that Lucio is the corresponding author, and was at the time the funding was through the Australian Health Workforce Institute. So just to go through some of those. The funding for the Nursing in General Practice program that was run through AML Alliance was funded through the Australian Department of Health. It was Department of Health and Ageing at that time, as part of workforce development. And I was just wondering, it's a bit hard to see here, but was there anyone here that was a participant in the nursing demonstration projects? Is that Donna up there? Yeah, good on you. And Cheryl, you're over there too, I think. Can I see Cheryl? Yep, and Roz, yep. So you can hold me to account then as I go through things. And I thought that the previous presentations, if you've been here for all of them, really tie in nicely with some of the issues that are going on and that were going on back in 2012-2013. So a bit about what was going on at the time. And about the research. So part of what I'm talking about is Lucio and his team's research at the time and the interviews that were undertaken, but also just a bit about the nursing demonstration projects. So the projects were part of nursing capability work that was building on prior projects, such as the Supporting Advancing Nursing and Development in General Practice, or SANS project. Was anyone here part of the SANS project work? Great, Rosemary, Rian. Yep, so you'll be aware of that. There's been a lot of work going on underpinning some of the work that's been going on. The health system was undergoing reform at the time, and Medicare Locals, and there was great opportunities for nurses in general practice, Medicare Locals and the community to understand the roles of nursing in general practice and where they might go. And once again, that ties in with our education and career framework development that we're looking at today, and we had the session yesterday that Rian kindly promoted earlier. So how fresh we looked on the steps there. This was our first face-to-face meeting in February 2013, and we didn't know what we were in for. The funding arrangements in the financial year came through a little bit later than what we probably would have hoped for, and so this was our first meeting, and the funding was up until June 30, 2013. So we knew that we were going to have to get our skates on and get things happening. So we were looking at building capability of nurses in primary care or general practice we're talking about and focusing on, and undertaking leadership roles at both clinical and professional level. Now about some of the evaluation and focus, there was, given the developmental and dynamic nature of the projects, there was specific participatory realist evaluations were used and semi-structured interviews. So basically, as part of the projects, nurses were interviewed, Medicare Locals CEOs were interviewed, and also practice managers were interviewed to see what their thoughts were on the processes of being involved in it. And the key questions were to explore how and why the nursing demonstration projects worked or didn't work. So this is some of the key achievements, and some of the that are listed here. And when we were on those steps, we were actually learning and skill building for the Medicare local staff that were participating, and there were also nurses from general practice that were recruited through the 12 Medicare Locals that were funded to deliver the projects. The project was also supported by an advisory group comprising of Liz Meadley, who may or may not be here. Liz, yeah. Emma Whitehead, who was the principal advisor at Australian Medicare Local Alliance at the time. Kathy Bell, who has been the CEO of APNA. And Rian Parker, who's with us as well and presented earlier. And there were also support was provided for the participants, nursing in general practice, and also Medicare local staff who were the champions for the change in the project over 3 workshops. So this is some of the meetings that went on during the time, and so these are actual nurses that were part of the different projects. And the one on the far right, your left, was a group, and that particular project at Barwon Medicare Local mimicked the Medicare Local Nursing Demonstration Project and how it was undertaken. So they ran leadership workshops. There were also, you'll see us, Lynn and Stuart Constable, who also delivered some of the Leadership in Action workshops, which ran concurrently with the nursing demonstration projects is there. So some of the key findings are available there. So I'm just trying to find my page. So some of the results included the establishment of nurse leadership networks, and some of the projects focused on mentoring, leadership and supporting the nurses working in the general practice area. There was also increased recognition of nurses within the Medicare Locals and the Medicare local area, particularly where there were Medicare Local CEO champions. And there was one particular CEO of Medicare Local who came along to meetings, introduced the nurses, and also brought the board along of the Medicare Local, and that was seen as instrumental in the project's success and sustainability as well. The project's success factors included the AML Alliance Project Managers Consultative Approach, the Medicare Local Project Managers and Nursing Relationships and Strategic Roles, the Medicare Local, as I've just mentioned, CEOs who championed general practice nursing, and there were several merging themes as well. And I think that when we've been speaking over the morning and yesterday, if you were here for the pre-conference workshop, you'll recognise some of those, the lack of value and recognition when we were talking about our education and career framework yesterday. So those were some of the issues that were coming up. And also the readiness and capability. We looked at things over the individual level, the practice level, the professional level and systems level during the demonstration projects. So some of the key emerging issues, as we, and this is continuing on from similar themes earlier in the day, is lack of career pathways, lack of authorising environment, and lack of value and recognition. But on the contrary side, during the demonstration projects, that might have been emerging issues in Lucio's and the Melbourne University's evaluation, but I felt that during our projects there were a lot of development of confidence that actually happened, and capability building, skill building and education. We got as far as to follow on from the Medicare Local Nursing Demonstration Projects came the advancing nursing clinics in general practice, and and we had some of the projects starting to develop nurse clinics at the time. So one project has flowed into the other. So here we see the opportunities for building nurse leadership and capability, and you'll recognise some of those, and that we've talked a lot about funding, but we've also talked about how we need to be able to sell our own message as well. I think that's really important. I think it's really valuable that it was very innovative at the time to have an evaluation planned all the way through the project. And I think that documenting, we talked about that we don't always sell ourselves well, but research is helping to document what we do, and I think it's absolutely crucial to supporting the nursing in general practice role. So these are the some of the demonstration, the Medicare Locals that participated in the nursing demonstration projects. And I'd like to acknowledge the work of the demonstration project teams and the Medicare Locals and the practice nurses that participated in the projects, and also for Lucio's contribution. He was very key in participating in the workshops that supported the projects. Also the CEOs that participated and the staff that were interviewed. And to thank Lynn for the opportunity to work and work with AML Alliance. And Lucio's take-home message is the importance of building nurse networks and how crucial they are. And so some of the other presentations that we've had and probably will have underpin those same messages. And because I'm channeling Lucio in this presentation, I just would like to let everyone know that 2015 is the year of evaluation. So I'd like you to take that away with you, and wherever you're doing work, to consider in the early planning of your projects the importance of evaluation.